Welcome, everybody. You are here, hopefully, for the ABHI Health Innovation webinar, where we're going to talk about how we can all give you some support to get into or indeed expand your activities within that health marketplace. I'm Judith Stewart. I'm the Director for Economic, Commercial and Business Development at Health Innovation West Midlands, and I'll be taking you through part of this afternoon session. But it's great to see so many people joining, so thank you for coming along. What we're going to do, we're going to have three of us have a conversation with you this afternoon. Richard Phillips is here from the ABHI and Nick Allen is here from Health Innovation Manchester, as well as myself. The plan will be that we will take questions. We will try and leave as much time as we can to answer those questions. So any questions that you have during the session, please put into the chat. What we will then do is collate those questions at the end of the session, and we'll send those out along with all the slide decks to you, hopefully by middle of next week is the plan. So hopefully you are all here for the right reason, and this is the right place to start. So welcome, as I said. What I'd like to do is now introduce Richard from ABHI for him to kick us off.
Judith, thanks very much. And as you mentioned, this is one of a series of these we've run over pretty much the best part of the last year with each of the health innovation networks. And I think today concludes, we'll have done all 15, will have been. And the plan now is we'll start again with various themes. So stay tuned for more of these in. I'm going to be very, very brief here. This is not about ABHI. And many of our members on the line will have heard all this before. This is just a real brief overview of our work to give a sense for those of you out there who maybe don't know us, maybe not part of our community yet, or didn't realise there were things such as trade organisations that exist. So I'll be really, really brief. So have the first slide, please. This will give you an overview of what we actually do as a trade association. Probably the most important thing we do is act as an interlocutor between the industry and government. So not a day goes by when we're not in discussion with officials from some department or other. A lot of work at the moment, obviously going around three major pieces of work. It's really quite an exciting time for health tech in that regard. So the 10-year health plan, the industrial strategy, including the life sciences sector plan, the NHS innovation adoption strategy. There's a life sciences and a health tech element to all that. We're very, very engaged with that. Regulation is what we were set up to do 40 odd years ago, and it's still probably the most important thing we do every day. If you were to chop us in half, then Blackpool Rocklight, you would see regulation ripped through us. And obviously it's probably the hottest topic of all our hot topics at the moment, as we're still trying to figure out what our new regulatory arrangements look like post-Brexit. We have a number of relationships, deep relationships within the NHS, and I include our relationships with the HINs within that. Our members also get the opportunity to network, notably through a network of member groups. We have over 20 member groups. Some are functional, HR, government affairs, regulation. Some are sector specific, so cardiology, orthopedics, ophthalmology, that kind of thing. We also, they're the real beating heart of the organisation that inform our work. Also, our insight and intelligence is the best there is. It's done by the industry for the industry. If you were to join us and just read our insight and intelligence, you would be better informed than your competition. And I always think if you're better informed, you're in a better position to be successful. We've got over 400 members now. Cognizant there are probably another 4,500 companies in the health tech space. That's diagnostics, devices and digital health technologies. Though our members probably account for 80% of the value of the industry in terms of sales to the NHS. And like the sector, our membership is about 80% SMEs. Our leadership team look like me, people that have been around the industry for a while. I've been in the industry since 92, devices since 92. The pharma from 92, devices from 97. Sales and marketing backgrounds and policy work probably since the turn of the century. So if you do the next slide, then that'll tell you how we organise ourselves. It's probably a slightly more important slide than it appears. We've got four functions. That regulatory function, the market access is about how you figure out the NHS. It's about health technology assessment, all that kind of stuff. The policy and partnerships work, then how do we create relationships like the ones we're highlighting this afternoon, and communications as well. And within that, we divide our work into various business areas. So digital health diagnostics, traditional medical devices, and also our program of international work, which I'll say a little bit about. That's good because it gives us focus without us being a niche organisation. So because that breadth gives us makes us a credible actor in the space, and probably the most frequently consulted organisation by the institutions of government. And there's just a very small number of our stakeholders in the middle. What I would say about that is we are where we should be most of the time. Next slide then, please, will tell you what our priorities are for the coming year. We've got three priorities. Growth, that's growth of the sector. We shouldn't be embarrassed about that. We're an industry association. The government is talking about growth, and ours is a sector which is chosen to drive growth for our country. Regulation, the product regulation, which is obviously important, but also our own compliance issues, good governance and ethical business practice, and increasingly ESG. So particularly around sustainability and social factors in procurement. Below that, there are a number of work groups which are key work areas which I won't go into, but just to call out a few: sustainability, obviously supporting companies, particularly smaller ones, about the requirements that they're faced with if they want to supply the NHS. If you're not aware of that, you really need to speak to us. And also our work around health equity and ED&I. That is also supporting journeys on their own ED&I, companies in their own ED&I journeys, but also a recognition of the fact that we know and we learn. One of the things we learned in pandemic, which the pandemic reminded us of, is that the most disadvantaged people in our societies are the ones who have the worst access to and the worst outcomes from healthcare. So how do we figure out that? So that's just a flavour of our work. Next slide then is I'm going to retire this joke, I think, after this slide, but this is a slide we've sent to the people at Guinness, which for the single PowerPoint slide that's ever been produced with the most number of words on it. I'm not going to go through this. When you get the copy of the slides afterwards, use this as a wheel. We use this to negotiate and navigate ourselves around the organisation. If you're trying to find out who's responsible for what in what areas, this is our wheel. So take that away and use it at your leisure. And finally, the last slide I'm going to leave you with is an advertorial for our international work. We run, I think, a dozen trade shows on just about every continent, as well as an accelerator program. Very well established now, probably close to 200 companies we've taken to the US over the past 6 or 7 years. If you are on the journey of exporting and are considering the US as a market, the most cost-effective thing you can do is to join our US accelerator, where we run 4, 5, 6 missions a year. In the course of a week, you'll get to speak to the senior leadership teams of 5, 10, 15, 20 large healthcare systems. On top of that, the guys are just back from Arab Health, one of a number of the major trade shows of which we host UK pavilions. That is a whistle-stop tour of our work. If you're not part of our community, please do be in touch with us, and I'll pick up any questions later on. But otherwise, Judith, I'll turn it back to you and our friends in the Health Innovation West Midlands and Health Innovation Manchester.
Thank you, Richard. That was great. And as Richard said, that's a very whistle-stop tour. ABHI, one of the most influential trade bodies that there is in the whole of the healthcare system. So, if you're not already a member, I would strongly advise you consider it. I'm going to talk to you about how we as Health Innovation Networks can support you as small companies or even medium or large size companies to really understand what's happening in the healthcare market and to ensure that your innovations are identified, developed, and then actually adopted. So the next slide, please. The Health Innovation Networks, we consider ourselves the health innovation adoption experts. What we know is that there's lots of people with great ideas, loads of companies working in this space, but actually the hardest job of all is getting those innovations actually adopted. And there's some stats on screen there that just identify exactly how we can manage this and the sorts of levels of activity that we have done. Just to give you some sense of context, in the West Midlands alone, in an average year, we're working with around 400 to 420 companies. So we multiply that up across all of the health innovation networks, and we're getting to 3,500 or so every single year. We take our responsibility really seriously because we work with our health systems to find, test, and implement those solutions that are going to make the greatest change and supporting our patients to have better health. But we equally take seriously our responsibility to driving economic growth. And you can see from that the levels of investment that we have supported our companies that we've worked with to leverage. We deliver a good return on investment. So if you haven't already been in touch with your local health innovation network, then I suggest you do so. On the next slide, we have a map of where we all are. So there are 15 health innovation networks across England. Just to give you some context, we are funded by NHS England and the Office for Life Sciences to do that innovation adoption piece. For companies, what that looks like is that we have a free offer of support to the majority of companies that come to us, and that will work into this big ecosystem here. We're working right across the elements from we tend to work kind of post initial testing when you've started to get to the point of having an MVP. Once you've started to really firm up your ideas, we do get involved in research projects, but they tend to be applied research. So when you've got something and we're testing it in the real world. So as you can see in that diagram, this is the whole of the health ecosystem, if you like, and where the various individual organizations fit. As health innovation networks, we're very much into that innovation and implementation science. So supporting you and your innovation to be adapted, refined, developed to the point where it gets its first sale, its second sale, and continued sales, so that we support you with spreading not just across one trust or one geographic area, but then all the way up to national. Our focus is absolutely on that implementation, adoption, and spread of innovation at pace and scale. And we do that by working very closely with substantial numbers of partners, particularly our health systems. Often, one of the real issues that companies can have is identifying who is actually the best person to speak to, how to go about contacting them. We'd like to consider ourselves as the way in to those health systems, and that's a key function of what we do. Next slide, please, Karen. So just considering how this whole process works, this is a good diagram showing all of the various components that companies need to consider when they are seeking to get bought into the NHS or the social care. And it's important that everybody understands we work with social care as much as with health. So if your innovation is in the social care place, we also would like to hear from you. We work across those 5 different sort of subsector or domains of activity. So we'll work with you on that idea assessment. Very often we have companies who come to us and they have the next greatest thing, and often they're from kind of a particular viewpoint or standpoint, from personal experience or from personal skills and abilities. One of the things that we are very keen to do early on is really understand what is it you are wanting to achieve. What problem are you actually solving for the NHS or social care? And within that, we can do a number of things such as market analysis. We'll consider what the unmet needs actually are, as opposed to what you may think they are. And we can also support you both with the idea development, IP, and getting that initial expert feedback. One of the things that we know about NHS systems is that they are very keen to see evidence generated by other NHS systems. So getting expert feedback early doors that helps involve or helps design and develop your product or service is going to be crucial. Getting into that idea development, so taking it on to the next stage. As Richard has said, sustainability is a very hot topic, and Nick will be mentioning this as well later on when we talk about procurement. But we'll also work with you to really develop your value proposition. Now, there can never just be one value proposition. I think it's a bit like a CV. You have your base CV, you have your base value proposition, but it will need to be tweaked and adapted for every individual conversation that you are having with NHS partners. We're also particularly keen to ensure that early doors you've got engagement from the patients or the public who will be impacted by your innovation. If it is entirely clinician facing, we want to make sure you've got that clinician impact or understanding and involvement into. And we'll help you get to a point where you're at the point of prototyping. Then it's very much about determining what is the best route for evaluation for your innovation or service. We focus a lot on real world validation because actually, with having done clinical trials, having done work in the lab, you get part of the picture. I always like to see it as the healthcare assistant test. What happens to this on a ward when somebody drops it, types in the wrong thing, pulls the wrong plug? It's very much that what happens in real life scenario, and that's what we mean by real world validation. We can help support you find a clinical partner to work with to develop an evaluation of your product or service that really takes into account the everyday business of what is happening. And there can be one of two main outcomes to that. Firstly, you'll get some really important learning. That may well feed into your further development of your product or service. It may mean you need to consider what training requirements you might need to have in place. It will give you really strong customer and patient feedback. Secondly, it may also decide or discover that actually there isn't a genuine place for your innovation. And what we try and do is encourage people to make those rapid decisions on what their next steps are. You then need to obviously face the game that is regulatory approval. It's forever changing. Again, it's a space where we have a lot of expertise across the health innovation network. And so if you're needing guidance and support to do that regulatory piece, then do talk to your local HIN. And finally, increasingly health economics or indeed budget impact modelling benefits realisation. What is the actual impact of what your innovation does? What does it do in terms of cost? What does it do in terms of service? Does it have an impact on waiting lists? How can it support the day-to-day operationalisation and efficiencies within the health service? So again, we can support you to run those kind of health economics, and more importantly and increasingly trusts are much more interested in budget impacts and, as I said, benefits realisation. There's a whole load of information all over the internet about that. We can help you identify the best approaches for you to take. Then we really get joy from getting adoption happening. So getting your innovations actually into a trust, into a GP surgery, into a PCN, into whichever appropriate part of the NHS it should fit. We recognise there's a huge amount of work that needs to happen in that space. It may be that you're required to write a business case. Often, clinicians, particularly in trust, are very busy and don't necessarily understand all the nuances of writing business cases. So we can come in and support you with that between you and the clinician. And that's the space that we often work, working in between and with both sides of the equation. So with the clinicians, but also with the innovators. Nick's going to talk about procurement, so I won't go any further on that. But that commercialization as well, have you actually got a sustainable business model? What is your repairs and maintenance contract going to look like? How do people actually purchase what it is you're selling, and how do they do that on an ongoing basis? We've all seen the headlines and we recognise the financial and more importantly, I feel, time pressures on the NHS at this current time. So being very clear with the people that you're talking to about what they are likely to need to pay and when, and also what any additional costs might be required. Does it need a new change in particular software? Does it need new hardware to be implemented? All of those are things that we can explore with you and support you to develop. Making sure that you are market ready and that you've got the right access points. So looking at who are the key stakeholders. Often the people that get forgotten about are both the patients and also the information governance teams and the procurement teams. And I always advise the innovators that I work with to have very early conversations with those extremely essential sections of an NHS trust or location. By ensuring you've got your IG and your procurement people involved up front, you're going to save yourself a heck of a lot of trouble later on. Having got that initial kind of adoption happening and ensuring that it's working, then obviously we move into that scale up and wider adoption and spread piece. That can take very many different routes. And it may be that you start to work in one trust and then go to a sister trust. Or actually, you might want to look at trusts who have similar profiles, depending again on what it is that you're doing. So, for example, if it's an orthopaedic innovation here in the West Midlands, the Royal Orthopaedic Hospital would be an ideal place to start. And you may move to other orthopaedic specialists across England as opposed to going trust to trust. Again, that spread planning is something that we can help with. As a health innovation network, we have now come together with an adoption and spread playbook that we're using with innovators that allows us to be far more consistent in the advice and also allows you to tell us the evidence once and not multiple times. A key element that is also often forgotten is that post-market surveillance, so we can help you set up techniques and mechanisms to make sure that what is happening when you left your product or service in this particular setting is what is continuing to happen. So as you can see, it's a very fulsome set of activities and support that we can give you. This is, as I said, what we suggest is kind of the clear pathway that you will need to follow. Elements will be deeper for some innovations than others. So if you're digital and regulatory, then we need to think about that. If you're a medical device, then obviously regulatory will be super important, as will be the clinical trials evidence. So there are elements that will have some greater prominence than others, depending upon what it is you do. But this will hopefully give you an idea of the various building blocks that we believe are required to get something adopted. If we move to the next slide, please, Karen. So just briefly, I wanted to talk to you about my particular patch, because I think this just gives a demonstration of the depth and breadth of the NHS. Less so with UK companies, but when I'm talking to foreign-owned companies who are looking to come into the UK, there is a perception that there is one NHS. I'm perfectly happy to blow that perception wide open. There is no one NHS. There are multiple and multiple partners who make up the NHS as an overall entity. And just across the West Midlands, we have one of the largest patches. So as you can see from that, we have 6 integrated care boards, 24 NHS trusts, 761 GPs, 24 higher ed institutes, 91 hospitals. So when you come to me and say, oh, I have this thing that will work in all hospitals, actually, have you really thought about the scaling of this and how best to tackle that? We've got 129 primary care networks. So again, anything that is primary care focused, if it works in one PCN or one GP practice, that's great. But in all likelihood, it will have to be tweaked and changed before it moves on to the next, or to be put in the next scenario and the next scenario. I also said that we do work in social care. It's often the unsung hero, though this morning on Radio 4, it was very clearly being aligned with health and the needs of health, wanting and requiring a really buoyant and useful social care setting. So we do work with over 1,700 care homes in the West Midlands. That's a whole nother different market, and we have expertise in how we access that market. So, for example, we have a social care network across the West Midlands where care homes can come and discuss what they're looking for. All of this indicates that there is loads of different spaces that your innovation can fit. And part of what we will do is help you navigate to find the best part of the system that you can fit in. 26 councils as well means that, again, particularly with that social care, but also public health, there's a lot of work to be done to understand who are the right people to speak to and how will we manage it. Next slide for me, Karen, please. Just to come to the end of what I wanted to go through, this is just a very quick summary. So I explained about the innovation pathway, but I wanted to pull out some specific areas of work that we can do with you. So lots of it is very much about getting to know you. Who are you? What is it you have? What evidence have you got? And actually, what is it you are wanting to achieve? It may be that you think there's a particular market in one clinical area, but we might suggest that you consider a different. We're very much built into the NHS system. So enabling that stakeholder and staff and patient engagement is something that we are keen to work with you on. All of that will really help you develop your innovation. The testing, as I said, is going to be crucial. If you imagine a clinician's journey to get to wherever they are in their career, they will have used evidence-based approaches throughout that. Medicine is evidence-based, and that is why having a really strong evidence base that shows and demonstrates clearly the impact that your innovation has is absolutely crucial. So supporting you with that testing, be it through project management of a kind of a real world validation, supporting you to set up training and staff learning activities, developing with you an evaluation framework that means you actually get really useful information out from what work you're doing. Too often we see companies who manage to get a pilot but haven't really thought about what questions they're trying to answer. And so the pilot happens and they don't gain as much as they could from that experience. That also flows into the data analytics and really making sure you understand what data you can and cannot have access to, what that data is actually telling you, and how you then use that to test your innovation. And finally, as I said right from the outset, the key element for us is getting your innovation adopted and spread. So looking at things like business impact modelling, as I've mentioned, supporting with that information governance and procurement elements, developing your case studies, building up those business cases. Those are all aspects that we can support you with as Health Innovation Networks. Last slide, Karen, please. If you want to get in touch with us, please do so. So that's the email inbox for the West Mids, but because we're doing this jointly with Manchester as well, if you want to use that email address, we will direct you onto the Manchester team as well. I hope that's given you a good flavour of how we as Health Innovation Networks can help. As I said, it's a very broad church. We can do lots of different activity for lots of different people, and we'd very much welcome the opportunity to work with you on your innovation to see the impact that it can have on patients and the whole health system. Now we're going to move on to Nick, who is going to talk about a particular hot topic for all of those who are looking to get into the NHS. Over to you, Nick.
Okay, thanks, Judith. Good afternoon, or should I say good morning? No, it is good afternoon. Good afternoon. I'm Nick Allen. I'm the Industry Procurement Advisor of Health Innovation Manchester. My background is procurement. I've been head of procurement at various hospitals around the country, the most southerly being Basingstoke back in the day, and more frequently in the northwest of England. I've sold to the NHS as well. I've sold procurement software. I've spent about 7 or 8 years travelling all over the country, visiting practically every hospital in England, Wales and Ireland, not Scotland, and I managed to get that procurement software in 60 hospitals, trusts. So I understand that the issue. I'm here to help many innovators, and I call it the NHS procurement conundrum because it is difficult, and Judith sort of, touched upon it earlier on about all the steps and the ways through. So these slides, there's about 11 slides. We're going to go on a nice journey, bit of laughter. Let's go. Next slide, please. Right. I went to some of the old CCGs before they became ICBs, and I asked some of them, what do you know about, what's your thoughts on innovation? Because we were struggling to get certain things in the primary care area, in the community, etc. And there was a deadly silence. And these are all the people who make decisions. They're all doctors and senior consultants and business people, and they didn't have an answer. So I basically put this slide up now when I'm meeting with people who don't get it. If you keep doing and buying the same things off the same people and expect different results, better patient outcomes and better pricing, it's not going to happen. It's insanity. So next slide, please. Where does it all start? So this is a bit of the basics of procurement I'm taking you on here. I'm not going to blind you with any science, but it all starts somewhere when they have a new need for things. So they develop certain types of people form a bit of a supplier selection panel or a tender selection panel, and they start to think about, right, what is it that we want? We need to draw up the specification. What did we use last time? How did we do it? What type of suppliers were involved? What particular area of clinical expertise is it? Is it orthopedics? Is it colorectal surgery? You name it. You find that what the specification is, get it all drawn up. But you also have to then start to work on the selection criteria. It's very, very important. And at the moment, years ago, it was say 80% on price and 20% on quality. It's all changed now. There's all things like social value that you have to take into account and sustainability. And whilst on my slide it's 10%, some trusts are pushing for 20% on sustainability and social value now. Price might be going down to 30. Quality is always reasonably high. And there's a few other little tiny bits and pieces. And once that selection criteria and the award criteria has been set in stone for that particular tender exercise, out goes the advert, expressions of interest come in, people start to look at the tender bids, etc., and they have to score it based on what they all agreed, right? How does this meet on social value? 8%, 10%, whatever. Price, what do you think? And they score it, and the winning tender just gets put to one side, and all the losers get told they've lost the business. And that's because there might be a challenge. There's a 10-day cooling off period for people to say, hey, I don't agree with this. You've missed something here, or we believe this. Once that's all been sorted, the winner gets awarded the contract, and the work starts to get planned with a start. Next slide, please. Right. Anyone on now who wishes to start thinking about getting some business, go to Contracts Finder, second one on there, free of charge. All contracts, all procurements over 20,000, and some trusts use it for 10, have to be placed on Contracts Finder. Those which are like over 118k still go on Contracts Finder, but they automatically, the big value ones, go straight through to find a tender. That is a new government portal. It's overtaken the OJEU, the Official Journal of the European Union, TED website, Tenders Electronic Daily, which incorporated all of the European countries when we were in part of the European Union. So definitely get on Contracts Finder. There's a recommended list of about 20 framework providers, and there's two there, NHS Shared Business Services, very big in digital, and they're in Manchester, and we work very, very closely with them. NHS Supply Chain is the huge framework provider of lots of consumables and products and devices, gizmos, etc. They don't touch too much on digital if they leave that to others. And obviously the hardest bit is the individual trusts. Now, I'm a great believer of approaching a trust, and I'll talk about that a bit later. Next slide, please. Right, this is something new, because we're on a bit of a basics of procurement. You might as well know this. As of April 24 last year, every single supplier existing and every single supplier proposing to do business with the NHS must have a carbon reduction plan in place. I recently sent a value proposition to a procurement department, and they said, have they got a carbon reduction plan in place before they even would look at it? So it's quite important. You'll get copies of these slides. You'll see some stuff about carbon reduction plans. There is an organisation called Business Growth Hub. I'm led to believe they're all over the country, but we've got one in Manchester, and they have an arm called Green Economy. and green economy get paid by the government to help SMEs in Manchester. So there may well be an arm, green economy, in a place near you, wherever you are, Midlands or, supporting areas. So try and find out about the Business Growth Hub, green economy, because they're paid to help you get your carbon reduction plans. And it's quite a simple task. It's about 2 or 3 pages long, and they work with you on what your travel is, what your suppliers you're using. It'll work on how much energy you use, if you've got a business premises, car, travel, train, you name it. It all goes in there, and it's quite easy to, once you get used to it, once you get to know what you need to do with the scopes 1, 2, and 3, it falls into place. Next slide, please. Right, as we're all sat down in our offices or in our lounges or little places of comfort, there's a new Procurement Act goes live on the 25th of February. It should have gone live in October, but this is a result of coming out of Brexit. It took about 5 years to come to fruition, and it's almost there now. And it's good news for SMEs and innovators, because it's cutting all the red tape out, and it's there to support innovators. It's to make things easier, faster, and people in the buying teams of all the hospitals and local authorities and police and fire, universities, they've all been learning on what the new processes are, but it's supposed to support SMEs to win more contracts. So that's got to be good news. Next slide, please. Right. I often ask this when people are talking to me, about, I've got something, I think this will help save this, and I think I've got that. But what we try to say is, if you've got like a device, for argument's sake, what are they using at the moment, and what makes your device different? What's going to win over a clinician to say, well, why should I change from that to that? Well, if it's the same price and it does the same, they're not going to get excited. So it's all about, looking at the established practices, what's going on there now, why yours is different, and to get, if you've got a really good value proposition or an idea on that, you're halfway there. You're not fully there, you're halfway there. Next slide, please. Right. One of the most important things is what I was just leading on to about the winning formula to get yourself over the line, and it is hard to get you over the line. We see 200 innovations a year, and it's difficult to support them all. But the ones who have listened, the ones who have got the evidence, the ones who've got the efficacy, the ones who have got a lower price and a better outcome, or even the same price, they're on a winning formula. Now, jump into the green one there, the losing formula. You would be surprised that some people come, it's got the same price, same outcome, it looks different, it's not going to win anyone over. Once a year, approximately, we have someone who comes at slightly worse price, but they're trying to tell us it's better, but it's the same outcome, so no one's going to get interested. It's wasting their time. Some people have wasted 2 or 3 years of their own lives on something that's never, ever going to get anywhere. I was at an event in Birmingham a few years ago. Some chap says, what happens if it's a slightly higher price and a better outcome? And I just thought for 10 seconds, I thought, God, he's right. Because there's a new thing now called value-based procurement, and it's paying a little bit more for a better outcome, and it saves money. It saves the patient coming back through the door in a year's time or 6 months' time. So it's slightly higher price, better outcome can be a winning ticket. You've got to have the proof and the evidence for it. Next slide, please. Right, my favourite movie with Yul Brynner, The Magnificent Seven, but these are my 7 sort of things that you should have in a good value proposition about understanding what the problem is. I think Judith mentioned that earlier on. What's the cost of us in the NHS running with this problem? Because sometimes we don't know. There we are, we're buying these things, but you're the expert. You've done all your due diligence and all your homework, you're saying it costs you X amount, whatever. And what have you got to show that it's better? How does it work? You got any testimonials? And then one of the things that people don't understand who aren't in procurement is there's a thing called SIP. And maybe Judith doesn't know what SIP is, she might do, but there's some people don't know what SIP is. It's the cost improvement programme savings target that's set each year by government, and it's about £4 billion a year. Now, if you talk SIP, like for argument's sake, one of you ring me, hi, my name is Karen Stevenson, or whoever it might well be. I'd like to talk to you about, saving money towards your SIP challenge, etc. Right away, she's got my attention because she's speaking my lingo, as a head of procurement, say, and she suddenly has got an in. Now, that's if you understand what the SIP is, and if you put it in your value propositions about how much you're going to say, what's the cost of your solution, is there going to be any savings towards our SIP? It's a bingo. Could be getting towards that, the golden ticket, the Willy Wonka bar thing. Next one is obviously the COVID-19 is an old one, but it's the net zero carbon benefit now, which is really high sustainability on our on our lips, thought processes. And I know the last one is that important slide, because when we've took something to someone, they'll say to us, well, what's their ask? What do they want? And that's important. You're going to provide a pilot. You're going to provide. Do you want to speak to certain types of clinicians? Maybe having a meeting with X, Y, Z, etc. Next slide, please. We're getting near the end. That's the good news. Getting past gatekeepers, right? I mentioned before when I was selling software, I was head of procurement of a hospital. I got a company in, they made something called MultiQuote. We helped them, we gave it a name even. I ended up working for them, so I had to go and learn how to sell. I went with 2 ex-IBM software sales guys for 6 weeks, 2 days a week, and they taught me everything I needed to know. And one of the things they taught me was getting the gig is the most hardest thing, getting in to the hospital. So they said to me, this is what you need to say. My name is Nick Allen. I'm talking to Judith now as head of procurement of a big hospital in the Midlands. Would you kindly let me know what the correct protocols are with regards to the products and services my company sells that may be able to help you save money towards your SIP, etc. And 9 times out of 10, she would say, well, what are your services? Then I've got to quickly, I'd tell her what it is. And then I'd say, have you got your diary with you? How you fix next Wednesday or Thursday? She said, oh, no, can't. Oh, it's okay. I'm in your area regularly. What flick your page over? What about? I gently cajole her to give me a date, and I'd go down, and then I'd start using the fabulous tools and tricks that the ex-IBM software guys taught me on how to win it over, how to win the order. I got it in 60 hospitals using exactly the same. My wife said to me once, you seem to be pretty good at getting in hospitals. Could you get me into Harrods with my complementary therapy products, ancient Egyptian healing tools? I did the same thing, contacted Al Fayed's, nasty name now, Al Fayed's PA, Fatima her name was, my name is Nick Allen, you kindly let me know, blah, 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 the correct protocols with regards to my wife's Egyptian healing rods, or whatever they were. Oh, well, next thing was, we're down there, 3 times we've been, and it works all the time. Next slide, please. I think that's it. It is it. Thank you. I think there's a Q&A shortly.
Thanks, Nick. That's really helpful. Thanks to you for that. As Nick explained, procurement is obviously the holy grail of why we're all trying to do what we're trying to do. Making sure that you get your products and services actually bought by the NHS is vital. It is a bit of a dark art, but as Nick's given you some really good pointers there as a way of starting that. So we have got just shy of kind of 15 minutes left for any questions. If you haven't, I can't see any that have come through in the chat, but if you would like to put your cameras on and raise your hand, we can take some face-to-face questions. Anyone got anything that they'd like to ask at this point? Or have we all stunned you all into silence?
There is a question. There's a couple of questions in the Q&A.
Oh, cool. Can you, Karen, read them
Of
out to us?
course. Yeah. Edgar Kayat has asked how to find the NHS framework for digital health pathology solutions.
As I understand it, that one is actually about to go out to reprocurement. What we'll do is I will find you a link for it, and we'll make sure you get that as a response to that question. It's a really interesting one at the moment. There's a lot of movement happening in digital pathology. I think there's a lot of really interesting products coming through. I think there's an awful lot of clinical engagement that is going to be needed with pathology networks, as much as kind of individual pathology teams, particularly on a regional basis. But yeah, we can certainly give you some advice on that. What we'll do is we'll find a link to where that's happening, and make sure you get that too. Thanks, Karen. Any others?
Yes, there's from Edgar again. Would you support a digital health pathology solution that is not considered a medical device? Also, how do we decide to which health innovation network to reach out first?
Right. So yes is the answer to the first part. Absolutely. We're interested in all and everything. I'm sure Nick would agree with me. We have worked with the weird, the wonderful, and everything that's practical in between all of those. So happy to have further conversations. In terms of reaching each of the 15, there's a couple of ways that you can do this or think about this. Partly, it will depend upon where you are targeting. So if you have a particular geography in mind that you are looking to target, then I would suggest going to the Health Innovation Network that covers that patch. So for example, we obviously cover Birmingham and Solihull. The University Hospitals Birmingham Trust is one of the biggest in the country. If you are interested in that, you would come to us. If there were particular specialisms or hospitals with specialisms to which your innovation directly results, then I would be making an approach to the Health Innovation Network that is closest to those. Alternatively, you can go to the one where you are based. So if you're based in the West Mids, come to us. We'd love to talk to you. If you're based up in the Manchester area, then go to Nick and the team up in Manchester. So it is really up to you. What I would suggest is reaching out to one of us, just so you understand how we work. We are 15 separate organisations, but there are groups of us who come together. So for example, as commercial director in the West Midlands, I meet monthly with my fellow commercial directors right across England. And we will hand people over to different teams where there might be specialisms or expertise that perhaps we don't feel we have. Equally, the kind of process is that we would ask you to complete a company engagement form. This is so that we have an idea of what your innovation is, who you are, what stage you're at, what you're looking for, what kind of investment you've had, if any, what you're looking for. So having completed the company engagement form, if for any reason we decided that we weren't best placed to support you, as Health Innovation West Midlands, for example, we would be able to send that company engagement form to another Health Innovation Network, and they could then pick you up from there. So that's how we work. We do collaborate lots these days, and so we can certainly make sure you hit the right place. Yeah, and my role is similar to Nev. Nev gets far more glamorous trips abroad than I do so far, but yes, Nev up in Yorks and Humber is my equivalent there as well. That was the other one that I picked up on the chat there.
Helen Taylor has also put in the chat that if you need help with Scope 3 emissions reduction and workforce engagement with net zero strategy, green plans, sustainability reporting, the NHS England and Greener NHS approved carbon literacy, healthcare course materials can assist you both within the NHS and the supply chain. So Helen has dropped an email in there. And
that's lovely. Thank you,
yes.
Helen. Just to say on the net zero point, as Nick said, this is now really it's an absolute requirement for procurement. Social value is not quite a requirement, mandatory requirement yet, but is increasingly important. And so thinking about all of that as you are designing or developing your innovation is going to be incredibly important. It also puts a real emphasis on how you've engaged with people. So don't forget to talk to people about what you're doing. Obviously, have it all safely IP'd away, but make sure you are talking to patient groups. Some of the clinical charities are a really good source of both intelligence and research funding and funding for development. Often go to people like we've got a really good relationship with British Heart Foundation, Cancer Research, you know, look at those people. Versus Arthritis are doing some really interesting work at the moment. So do think outside the box. One other thing I'd say, if your innovation is something that isn't necessarily directly clinically focused, but could make lives better for either staff or patients, another place to consider getting some funding or support from are often the large hospital trust charities themselves. So they are a good place to go if you've got something that's slightly outside of the box, and they do, you know, they do look for interesting things that will make the lives of patients and staff particularly much better. So just another wee tip for you there. Karen, have we got any more questions?
There's one more from Michael Morgan Karan, who says, if you've completed an engagement form with another HIN, do we have to redo yours?
No, just tell us which one you've done it with and we'll get the form from them. Right, yeah, we've got a hand up. Karim, would you like to come in?
Hello, thank you.
Oh, you're very faint, Karim. I'm sorry. Can you just try speaking up a little?
Sorry, is that better?
Yeah, go for it. We'll do our best.
Sorry, there must be. Yeah, thank you for the session. You've already answered a couple of questions I had, which is really useful. One of which you touched on was the fact there are so many parts of the NHS talk about how they can help with innovation. Finding that first front door in order to be directed to the right place being quite difficult. Really, it was really helpful that Nick mentioned shared business services, which is an area we've looked at as well. Whether maybe we should be talking Manchester area if you've got a good relationship with them. Although I'm based in the West Midlands, so I'm more than happy to talk to you as well, Judith. So our product, our service is not clinical, and as the last questioner was asking as well, it's even more difficult to find the way in for things that are not clinical device digital solutions. So did you think that our product would help with how any organisation, in fact, and the NHS is no different in this, being a very large productivity, decision making and risk reduction is what we're all about. Data-based analysis, capturing all that data that's currently spread all across the organisation, any different silos, pulling it together and gaining the insight. We've got case studies building in lots of different domains, trying to work out what the best way is of showing value in.
Yeah.
Is it something we should be coming to health innovation?
Yeah, absolutely, Karim. I think we can definitely help kind of doing that some of that navigation. I would say that you're entering an incredibly busy marketplace at the moment. It will depend upon the specificity of exactly what your innovation does. There is a lot happening in that kind of trying to use the data differently and better. And if I'm perfectly honest, one of the issues that I think we continually find is that NHS staff themselves are not necessarily skilled in understanding how they could look at that differently. So I think there's a really interesting piece around doing joint work with a trust or a system to upskill staff in what could be the gain from that. Productivity gains is something that is being talked about an awful lot, but I think the practicals of that and actually proving a value for money case starts to become really interesting in that space. Nick, do you want to come in?
Yeah, I'll just put a little thing in the chat for Karim. If he wants me to help him, I'm there to help.
That's cool. Thank you. Yeah, definitely follow that up. Follow that up with Nick and Karim if you want a separate conversation. Happy to have one. Okay, I'm conscious that we're now at 3 minutes to 1, so unless there are any other burning questions, I will say thank you to you all for your attendance. Thank you for listening to us. As I said at the start, we will send out the slide deck. We will try and make a link available to the recording. That's always slightly tricky, but we'll do what we can. We will make sure that you have a copy of the slides, and we will provide any other responses to questions that we haven't covered off so far. Richard, any last thoughts from you?
No, not all. Great session, and it does. I think you've illustrated well or a lot of the questions illustrated well I've stopped calling it a complex landscape. I'm calling it a diverse one, and there are lots of ways in, and in some ways there's no magic bullet. You've got to be tenacious and keep going. But we've always been huge supporters of the health innovation networks, and that honest broker role you play, I think, is absolutely essential and become more essential as particularly as we head into the next financial year and the challenges the service is facing, and the need to use innovation to drive those three shifts, and also address that almost mutually exclusive task the service has of getting its RTT, its referral to treatment times back on track, but not running a deficit. That's impossible in the current situation. So big role for us to play in that, I think.
Yeah, thank you. Nick, any final thoughts from you?
No, I thought that was very good on everybody's half, and some of the questions and some of the comments have been nice. Somebody saying there, Michael Morgan, well done all. And I just put there, we just keep giving, don't we, Judith?
We do. Just to summarise then, we are all here to help you. ABHI, the HINs, we're all here to help you. Do make contact with us. Thank you so much for attending, and we'll get some bits and pieces sent out to you. Look forward to meeting with you in due course as well. Many thanks. Bye.
Bye.